Another concern that some patients have is complaining regarding the lots of vaginal discharge. Discharge is normal throughout the day or night. And the consistency is different everybody during the cycle. It could be thick or thin. It can have different smells. As long as it doesn't have any itching or any burning, it's usually normal discharge. A lot of discharge could be sometimes physiological and normal. If it's something that bothers you, you want to check with your OBGYN. It could be sometimes yeast infection, BV, or trichomonas, or other things that can be checked. But I do have patients who have lots of discharge, which is normal for them. And we do all the tests that comes negative for STDs, for yeast, for BV. And sometimes I do give antibiotics trying to decrease the discharge. But in some patients, it's just the normal body and nothing that can be done or nothing necessarily has to be done in that regard.